So oral biofilm is the largest cause of oral inflammation. I want you to think about this. Oral inflammation is the #1 source of inflammation in humans. And we've already determined that inflammation is a bad deal. So let's go through some of the ways that this has an impact. In 2011, Journal of American College of Cardiology stated periodontal disease is directly related to atherosclerotic inflammation. That's stating that gum disease has a direct effect on the inflammation around the heart and throughout our arteries. So the Surgeon General tells us that upwards of 80 to 85% of American adults have some form of periodontal disease. That's a big deal. It's a lot of people, and it's also one of the most overlooked areas of inflammation in human beings. Now, there are other factors, and I talk a lot about inflammatory burden and the tree of inflammatory burden, and you have branches of things that influence. But oral inflammation is a key player, and it's one to never be overlooked. So back as far, once again, as 2005, in Circulation stated that there was a direct relationship between periodontal microbiology and subclinical atherosclerosis. So the research has been compounding here, and if you notice, most of the research papers are out past the time of the Genome Project. And the reason for that is the Genome Project was kind of our health trip to the moon. We had government funding, we had major institutions that came together, and they were jointly approaching the genomics of human beings, mapping everything, and also now going out into diseases and microbials and pathogens. And what happened with that, and I asked this question a year ago to a buddy of mine that's one of the top players in that, and he said it was the tools that really were some of the biggest changes, because they came up with tools where we were able to see things that we were unable to see. They're able to take non-culturable pathogens and find out what's present. Before, we used to be completely stuck in the world of if it was not culturable, it wasn't there. And nothing could be further than the truth. Most of the stuff we study now are actually variations of pathogens that are non-culturable. So this was stated at a recent health symposium directed towards preventive cardiology. Don't ever forget to look at periodontal disease as an important source of inflammation in reference to cardiovascular disease. Like I said before, the harmless bacteria, and we know of over 500 bacteria in the mouth. And they're part of our digestive system, they're part of our oral flora. There's a symbiosis going on there where it's a positive versus the negative, and the host, that is a good thing. And most of those are gram-positive aerobic bacteria. Now, in periodontal disease, most of the ones that are causing problems are gram-negative anaerobic bacteria. And in periodontal disease, the bacteria balance shifts over to those, and inflammatory disease and injury develop with these diseases. They're associated with periodontal disease of various forms. They're also associated with overall inflammatory diseases. So I put this in here just to give you an idea. Traditionally, it was thought if you had small pockets around the gums, and dental professionals understand what pocketing is completely, but around a typical tooth, there's an area of unattached gum or gingiva, and that's usually 1 to 3 millimeters, a sign of health. And most of the time it is. The reason being, oxygen diffuses into the fluid in there. The bacteria that like oxygen live there. The ones that hate oxygen do not. Those are the anaerobics. When you get deeper pockets, traditionally those are signs of disease, and that's where the bacteria live that don't like oxygen as much. They're involved with deepening the pockets. They're also involved with bone loss. Those are the similar bacteria that are associated with some of the inflammatory diseases that we talk about. But it's a little more interesting that it's not just the visual of shallow pockets versus deep pockets, and I'll go through that in a little bit. So in the Journal of Periodontology in 2009, well, it was a huge eye-opener in my eyes, because PG, Porphyromonas gingivalis, that shows up in all kinds of research involved with cardiovascular disease, was shown to raise the risk of having a heart attack by over 13 times when present. To put this into perspective, if you're a heavy smoker, and we all know that being a heavy smoker puts you at risk for heart attacks and strokes. If you're a heavy smoker, you're just barely 7 times as high of risk. So this is more than twice as high of risk if you have PG than a heavy smoker. This is a big deal, and this is something that should be addressed in my eyes, and I'm going to give you some other reasons why it's even a bigger deal. Because PG doesn't just show up in the individuals with terrible trench mouth, teeth about ready to fall out. PG can show up with people that have relatively healthy looking gums. So we cannot use a visual approach to this. We must look at it from a standpoint of addressing what is actually there through the microbials and the salivary diagnostics.